All right, well, good afternoon, everyone. My name is Diane Littlefield. I serve as the Vice President for Programs and Partnerships at Sierra Health Foundation. I just have to start with saying, wasn't that an incredible, fantastic morning? Yeah. Yay. And thank you so much. So wonderful to be here. A few years ago, this was just a dream. And today, we're nearly 1,000 people strong. Hashtag Golden State for all. And, what an incredible morning. Even the rain cooperated, right, Chad? So we would like you to continue the conversation that began this morning and follow us on Twitter, Facebook, and other social media channels. Please use the hashtags hashtag Golden State for all and hashtag SJVHF. This afternoon, we will unveil new report, California's a region and its children under stress. This report, which you should have all received a copy, and if not, we will get one for you. Many of you may have been involved in the development and providing information. Valuable report. The report was commissioned by Sierra Health Foundation and the W.K. Kellogg Foundation and prepared by the University of California, Davis's Center for Regional Change in partnership with the Pan Valley Institute. I would like to acknowledge Dr. Jonathan London and his research team. If you could stand, Dr. London. And thank you. As well as I would also like to acknowledge Ms. Inez Nateras with the Pan Valley Institute. Their incredible determination and commitment to provide a report that would serve us in our work moving forward has been instrumental, and we want to thank you. In preparing for this report, as many of you know, the researchers met with many of you, met with many residents and those working with on behalf of Valley communities to learn what their priorities are for policy and systems change. I am very proud to introduce our CEO and President, Sierra Health Foundation, Chet Hewitt.
It really was a great event this morning. Don't you think so? I want to thank all of you for showing up despite the weather, despite the long travel. I was told that some folks got on buses at 4 a.m. this morning to actually be here. A great part of my morning when I got up was that I was actually getting photos sent to me on text messages of the buses. And I'll just tell you, if you heard my comments outside, I was so inspired and feeling so fortunate and blessed to actually be here. This next part of our day really is kind of a culmination of what this event was really all about. We spent a lot of time talking about health generally in the San Joaquin Valley, the health disparities that we all know we need to address, and in particular, its effects on children and families. And so while the report documents the many racial health and other inequities and their particular effects on families, it's also a document that has a lot of hope built into it as well. Many of you have spent countless hours working with our partners to kind of craft a policy platform that we are now bringing to the Capitol. These are your ideas, your thoughts, your hopes, your aspirations for a different, more healthy future as we go forward. We know some of the things that are articulated in that report really are quite shocking. 1 in 4 children attend schools where the water is really unsafe to drink. If you're a Latino child, you're 46 times more likely to go to a school that has some form of pesticide exposure. High rates of obesity and food insecurity in a region that feeds the world. We know we can do better for our children. We know we can do better for our families. We know we can do better for our communities. You know, today's briefing is really built upon a very simple and elegant strategy. It says that if we all work together, if we all work collectively, if we bring our best ideas, our best thinking, our passion for change, that change will in fact happen. Not a maybe, not just a hope, but that it will in fact happen. Now, I believe in this deeply because I think we have some extraordinary champions, some who have been waiting a long time to join this particular movement. And I feel fortunate that we have two of them sitting here at the dais with me this morning as well. And these are not just individuals that we've invited to be here because of the important positions they actually hold. These are folks I've come to know a little bit. So when I say that they're passionate about the work, it's very, very real. Let me start by introducing Secretary Diana Dooley, who is the Secretary over Health and Human Services for the state of California. This is a big job. She runs 13 departments within that particular agency. Health, public health, mental health, behavioral health care, and others. Child welfare, human social services. She's also the chair of California Covered, as well as numerous other boards and commissions that fall within the purview of health and social services in California. I've come to know Secretary Dooley. We meet occasionally, and she's come and spoken at the foundation and attend some of our health CEOs meetings to kind of give us updates on where things are going. But aside from her extraordinary service to California over many years, what I've always appreciated about her the most is her real deep commitment and passion for children and for the San Joaquin Valley. She is, in fact, a daughter of the Valley. She grew up there and actually reminds us of that often as she speaks about, you know, her time growing up in California and growing up in the Valley. We are really thrilled that she's agreed to join us here today. She's going to reflect on some of the information that's in the report, but also share with us some of the things that she and the departments that she leads are doing in order to ensure that California is, in fact, a golden state for all, and that our children, your children, the children of the Valley, have every opportunity to be as healthy and to prosper just like children in other parts of California as well. Please, let's give a great San Joaquin Valley welcome to Secretary Diana Dooley.
Thank you so much, Chet. I am humbled to be here with this leadership team. The work that they are doing to lift up the needs of the San Joaquin Valley is extraordinarily important. As Chet said, I was born and raised in Hanford. My husband and I went to high school there. I was the first in my generation to go to college at Fresno State, which was a big deal, and very grateful for the education I received. I came here and was lucky enough to get a job and ended up working for this governor when he was governor in the 70s. And at the end of that administration, I went back to the Valley. I and my husband moved home. We raised our children there in the Kings and Tulare areas. I worked in Fresno. I was the general counsel at Valley Children's Hospital. I saw every day the needs of this valley and did all that I could to advance them. I work with the groups that you are a part of, that you lead, and leadership happens in every part of the valley. I am very proud of that, and I am very proud of the initiative that you have taken to come to Sacramento today and to be engaged with each other, because you are what will make this report real. This report lays out the facts that you live with every day. You know the reality of the problems that we all face in the San Joaquin Valley. but it takes local action. It takes you joining with your neighbors and friends and making a difference. I did that in the 26 years I lived there until I came back here. When the governor invited me to be a part of this administration, one of the very first things I did was assure that our partnership for the San Joaquin Valley would be maintained, and it continues to advocate on behalf of the issues in the San Joaquin Valley. I go there as often as I can. I lift up the needs of the valley in every way possible. But I know from my years of living there and working there with you and your groups and organizations that you make a very real difference every single day in your schools, in your churches, in your communities. You help with the food banks and the homeless shelters, and we started the first domestic violence centers back in the 70s in the San Joaquin Valley. We know what local action is and what it can do, and I am deeply inspired and moved by the effort that you've all made to be here in this glorious rain. Don't we know from the San Joaquin Valley how important this water is to us? But I really was grateful to accept Chet's invitation to be here today, not to tell you what you already know, but to thank you for the work that you do and that you will continue to do to make a difference and lift up. I know living there in all of the years between Brown 1.0 and Brown 2.0, that there is a sense of feeling forgotten, that we are left out. We are the other California in the San Joaquin Valley. We are not the coastal. We are not the cities. We are the heartland, and very often our needs are much more like Kansas and Arkansas than they are like Los Angeles and San Francisco. But we are very much a part of California, and we're critical to California's future. And I, again, want to thank you. I am delighted for the report and what this gives you as tools in the Valley with the organizations and the leaderships there, and for the leadership of the Sierra Health Foundation. This happened because Chet Hewitt had a vision, and he brought other people with that. And indeed, one person, one at a time, makes a tremendous difference. And so my message is, do what you are doing at home, what you have done today by coming here and showing the importance of this report and the work it will lead to, and know that I will always be your champion. And when I am aware of something that I can do, I do everything I can to make it happen. So Chet, thank you very much for your leadership. You are very lucky to have Assemblyman Tony Thurmond here with you today. He's not from the Valley, but that's he gets what we face in the Valley. And I thank you all, and very best wishes for the rest of the day, and for very safe travel home, and let this rain keep coming. Thank you so much.
I said that she was a true champion for the Valley, and know that to be true. Thank you so much, Secretary. Really appreciate your welcoming remarks. The next person we're going to ask to come to the podium is Assemblyman Tony Thurmond. And I have intentionally not tried to read folks' bios in a kind of formal sense. I said that I have actually known the folks who are speaking today, and of course Tony is another one of those individuals. Tony is from the Assembly District 15 in Contra Costa County. He was recently appointed to be chair of the Labor and Employment Committee. But I know Tony from back when. I know Tony from back in my days when I was Director for Social Services in Alameda County. He and I worked together around youth, with a particular focus on kids in foster care. We started some of the first transitional housing programs in the state of California many, many years ago. And I've known that he has always had a big heart and a real passion for what was affecting families and children. He's articulated that when he served on school boards and other elected positions, and now he brings that same passion representing his district, but also thinking about all children in the state of California. here to Sacramento in his new role as well. Let me bring to the podium Assemblyman Tony Thurman.
Thank you, Chad. Good morning.
Good morning.
Buenos dias. Nehoma. That's it. 3 languages. That's it. I can't do any more. Thank you, Chad, for the introduction. Thank you to the Sierra Health Foundation for your great work, and to the San Joaquin Valley Health Fund for your work. And thank you for all of you for getting up at 4:30 in the morning and coming to this house, your house, the California State Capitol. Thank you for coming here. Gracias por venir aquí. And thank you for lifting up the message of health and public health and education and good jobs, because we work for you, and it is our job to fight for you. And I hope that you will take the report and talk with your legislators here in the Capitol or in your community or to your school board members or to your mayor, to let all of the leaders know that we must make sure that all of our communities have clean drinking water, that all of our communities are safe from crime and from environmental hazard, and that we all have access to quality health care no matter where we live in our state. I lost both of my parents to cancer, and so it's important to me that we talk about health and health access and making sure that everyone has access to health. And that's why I was very proud to work with Senator Ricardo Lara to pass SB 4, the Health Care for All bill that guarantees health to undocumented children, because we believe that everyone should have access to health care. I was proud to support Senator Lara's bill that also says that anyone, even someone who may be an undocumented immigrant, could pay their own money to buy health care. And so we are living in an unusual time when there are those who are threatening our healthcare system. They want to take away the Affordable Care Act at a time when California has grown the number of people who are insured dramatically more than any other state. And we won't stand for that. We want to make sure that every citizen in California has health care, and we will continue to fight to protect it and fight to protect you, to make sure that you have health access. And we want to make sure that everybody who lives in California can get a quality education, and that's why we did a bill that gives money to school districts to make sure that young children can learn to read by 3rd grade, and that we can improve our school attendance, and so that we make sure that we keep our kids in school and not in jails and not in the criminal justice system. And this year, we've introduced a bill that puts a tax on every company that has a private prison in California or makes money off of prisons. We're going to put that money into preschool programs and after-school programs so that our children can learn and have a great future and live the California dream and be able to support their families and take care of their local community. That bill will raise $500 million for preschool and after-school programs. We hope that you'll support it. It's called AB 43. We hope that you'll support the bill. And just want to thank you for the great work that you're doing. The last thing is this. We're going to have a conversation throughout the whole state to help people who want access to health care. 2 things. One, to say that if you're eligible for a program like Medi-Cal, that we help you to get enrolled, because there are many in the state who are eligible for healthcare services who don't know, or maybe there's a language barrier, and that's why I'm really proud that last year we put money in the budget to have language interpreters for the Medi-Cal program, so no matter what language you speak, you can receive the information in your native language and be able to apply for Medi-Cal. The other thing we want you to do is to make sure that anytime your child is having oral surgery or is involved in pediatric dentistry, that you can have an anesthesiologist present to make sure that your child will be safe throughout the surgery and from the effects of anesthesia. We have a bill to guarantee that children under the age of 7 in surgery can have access to an anesthesiologist to protect them during the surgery. So thank you for coming to your house and to this Capitol. Thank you for what you do, and it is an honor to serve you. Thank you so much.
Thank you so much, Assemblyman Thurman. We are now going to transition to a panel, And so I'm going to ask Kai-Ying Hang, who will be moderating the panel, and the panelists to come forward to the table here.
Thank you so much, Diane. We could not do this work without an incredible team, and so every day I'm so thankful to be on the team with Chet and Diane and all of my colleagues here who've made today possible. I want to just let everyone know that not only is this room full, but the balcony right up there is 100 people full. Yes. And then we have the basement actually full too. So I'm so thrilled that we have an incredible turnout for this conversation. It's such a pleasure for me to introduce this next panel discussion. This is where the rubber hits the road in so many language, right? So to speak. The individuals who have joined us this afternoon, are individuals representing good institutions doing incredible work to advance the priorities identified in the report. I'm going to introduce each one of them, ask them to wave just so you know who they are, and then I'm going to turn it over to them each to say a few words. So let me first begin with the person to my immediate left. Mayor Michael Tubb is currently the mayor of Stockton. Yes. I have to say that in the time that I've been with Sierra Health Foundation, I have had the pleasure to get to know Mayor Tubbs. And you all, I have to say, he exemplifies the rising leadership of the San Joaquin Valley that is working, going block to block, door to door, to ensure that the community has a brighter future. He previously served as a city council member, and he was instrumental in the establishment of the Reinvent South Stockton Coalition, which is fundamentally today changing Stockton. So thank you for joining us, Mayor. To my immediate right is Go Ia Yang. I love it when I can pronounce, I don't know if you like it, but I like it when there are other Hmong who can pronounce my name too, right? Go Ia Yang is the California Director of Programs and Policy with the Southeast Asian Resource Action Center, otherwise known as CRAC, a national organization based in Washington, D.C., that advances the interests of Cambodians, Hmong, Lao, and Vietnamese Americans by empowering communities. Go Ia also represents the wave of new leaders, much like Mayor Tubb, that are ready to utilize their expertise to dream boldly and to ensure that the valley becomes stronger and healthier. So, thank you, Go Ia. We'll go back on this side, and Carmen Medrano is the regional organizer for a newly created organization called Faith in the Valley. Not new to many of us in this room, right? Because Faith in the Valley is a faith-based organization, community organization made up of 5 PICO affiliates in the Central Valley, all the way from Visalia up to Stockton. So we are so proud that Faith in the Valley has come together and that Carmen is here representing this incredible organization. Faith in the Valley is grounded in racial justice and health equity. And with the leadership of vision of strong community organizer and faith community, a regional effort is taking place to create a much stronger, much vibrant valley. So thank you, Carmen. Last but not least is Kendra Rogers. Kendra is the Managing Director for Early Childhood Policy at Children's Now, a California-based organization dedicated to improving the lives of children. Kendra was formerly the Executive Director of First Five Fresno and has a long time history of speaking up for the most vulnerable children. Her commitment to KISS has led to powerful partnerships being established in the Valley today that prioritizes and put kids first. So thank you, Kendra, for joining us. We have asked each of our panelists to make their remarks 7 to 8 minutes. We've asked them to specifically talk about the report. What surprised you all? What will it take to ensure that children in the Valley have a healthy future? And why must community members be involved in the transformation that we'd like to see in the Central Valley if we are truly going to be able to make California a golden state for all? So with that, I am going to turn it over to, let's start with the mayor first, and then we'll just make our way through. How does that sound? Okay.
Well, good afternoon. I'm going to be brief because my mom taught me when I'm around a bunch of women, especially women who are smarter than you, you listen. So I'm going to be very brief and listen to the great reports and all the work that's being done by those on this panel with me. Well, just briefly, I guess the only thing that surprised me about the report is the lack of moral outrage. In the 21st century, in the Golden State, it's ridiculous when 1 in 3 children live in poverty. That's criminal to me. It's crazy. It's ridiculous that 1 in 4 kids in some counties don't have access to clean drinking water at school. That's crazy to me. That's ridiculous. It was surprising to me that people aren't upset about the fact that we live in this agricultural breadbasket, yet folks don't have access to fresh food. To me, that's crazy. So I guess for me, the big takeaway is that these statistics aren't new. Raise your hand if you were surprised with the report that said the San Joaquin Valley was struggling. You were surprised? You didn't know you didn't know the valley was struggling? You were surprised that it's news, right? And therein lies the issue. And therein lies the issue, and that's why I want to spend a couple minutes talking about is how do we go from report to action, right? Because we can have convenings and we can commiserate and talk about how tough it is for our kids in schools and how 70% of our kids aren't enrolled in preschool even though they qualify for free slots, or how we can't get free drinking water, or how we're not invested in. And we could talk about that and go back fired up, but it's really going to take a real comprehensive policy agenda to move this thing forward. And the issue with that is that it's difficult work. It's one thing to read a report, it's another thing to sit down with the policymakers, whether it's your mayor, your city council, your school board, your county supervisors, your assembly members, and really talk about how do we move from these problems to solutions. And that's going to take work. It's going to require us to read. It's going to require us to ask questions. It's going to require us to really educate ourselves with the data. Because oftentimes we can talk about the stories, and the stories are powerful, and now we have data. So with stories and data, we should be able to move something. And if we don't, it's not Trump's fault, it's not the governor's fault, it's our fault. Because oftentimes people forget that politicians are a reflection of the people they represent. They're not appointed by God, they're not born into the position, they are elected by somebody. Whether you vote or not, the politicians in your community are a reflection of you or your cousins or somebody that you come in contact with who voted for these people. And that doesn't mean we have to go in there and yell and burn things down and be angry, because most of the times the folks in those positions are new, number one. And number two, they're removed from a lot of the lived realities, so they need education. But we can't allow ourselves to continue to talk about how the valley is struggling and not give people a comprehensive roadmap as to how to fix it. So if I was out in the community and we were like, Tubbs, what would you do for the San Joaquin Valley as a region? If talking to state legislators and state assembly folks, I would say, well, let's look at what the federal government did. A couple years ago, they started a Promise Neighborhood and a Promise Zone program that said, let's look at the 5 worst parts of this nation and invest in them with resources. And if they don't do it at the federal level, there's no reason why in Democratic, progressive California, there's not some sort of Promise Zone type program for the San Joaquin Valley in this state, so they get access to state grants, federal grants, help, and attention, because the issues we're talking about in this report aren't one person, one agency aren't equipped to solve. A mayor and city council can't solve all these issues. A board of supervisors can't solve all these issues. A school board can't solve all these issues, but we have to find ways to bring these folks to work together, because our lives aren't lived in silos. The government may operate in silos, but our lives, we want clean water, fresh food, good education, and safe streets. And I want to say, it's not crazy to ask for those things. You deserve that as a human being. And we're not asking for a handout. We're asking for just an open hand. We're asking for people to work and collaborate with us. So don't feel like after this, when you're talking about things, you're not begging for anything. You don't have to beg for fresh water. You don't have to beg for quality education. You don't have to beg to not hear gunshots on your street at night. You're not asking for anything crazy. You're asking for what is due to you as a human being, so we should act accordingly and be bold, be audacious, and make righteous demands. We want clean water. We want health care. We want our kids to be enrolled in preschool. 2 more things and I'll sit down. The second thing is that a lot of these things government can do, but government can't do everything. For example, the stat that says 75% of kids who are enrolled in preschool, who should be enrolled in preschool, aren't enrolled, that's not government's fault. That's our fault for not talking to our neighbors and our cousins and the folks we go to church with and telling them that there's free preschool slots for them and their children. The money is there. The slots are allocated. We have to do our part and make sure those are enrolled. So there's some things we can blame institutions and policymakers for, but there's some things we just have to do for ourselves. If the money is there, if the slots are there, there's no reason why they're not filled unless we don't want our kids to have quality early education. And then that's a different conversation. And then in conclusion, I want to just highlight some of the work that's been going on in Stockton, because we have fabulous community organizations that without resources, without notoriety, without shine, have been putting in work and inspire me every day. We have organizations like REACH, which is working with So look around. So those of us that know, we have to educate those that don't, because in the next 4 years, all of these communities will be undergoing a general plan amendment. In this report, it talks about land use policies. That's determined by the general plan. The general plan is made by planning commissioners that are appointed by city council members. And oftentimes what happens is that those that know the game play, but those that don't know the game get played. So if you don't know the game, you don't know land use, you don't know what it means to zone things, you'll be left out. And then 10 years later, we'll have a discussion about how come we weren't zoned appropriately. Well, for 3 years, your mayor, your council, and your planning commission were working on a general plan that you weren't a part of. So I think in addition to this report, if we're serious about changing things, they're not going to change by themselves. We have to educate ourselves. Because again, like I said earlier, these aren't acts of God. These are acts of men. These are policy discussions. These are conversations happening on your tax dollars. You're paying for this. The reality that you live in, you also happen to pay for. So you have a responsibility to change it. And the last thing I want to say in regards to this report is 6 years ago, I was on the Freedom Rides with some of the original Freedom Riders. And one was 20 years old. We were riding through the South, and he said, "Michael, I was arrested on August 4th, 1961. Why is that day important?" And I said, "Well, sir, you were arrested." And then he said, "On that day, Barack Obama was born." And he said he had no idea that the choice he made without a title, without a degree, without any power to do what he could to desegregate this nation would pave the way so that 50 years later, a child yet unborn will be president. And that's the question we have before us today with this report. What are we prepared to do today, individually, whether you're the mayor or an organizer or a parent? Everybody can't do everything, but we can all do something. So what are you prepared to do today so that 50 years later, the valley doesn't look like this? What are you prepared to do today so that 50 years later, a child born in your community has the chance to one day be president? Thank you.
Thank you so much, Mayor Tubbs. I am actually, with permission from my colleagues up here, going to request an interruption to be able to introduce Assemblymember Dr. Joaquin Arambula.
So Amparo, I got Amparo Sede, who's in the back. She's going to be my valley thermometer, if you will. Sometimes I get a little too hot. Sometimes I get too fired up. So she's got to tell me when, like, I got to hold it together, right? Because look, I don't think any of us are that surprised by what we see in this study. You know, I was born and raised in the San Joaquin Valley. I was born in Delano, in the middle of the farm workers movement. And I moved to Fresno when I was 6, and I grew up off of Belmont and San Pablo. I like to say it was the wrong side of the tracks, you know, but that was my home. I grew up in 93728, which, if you look across the state, is one of the top 25 worst economic and environmental zip codes that we have in our state. And that same zip code that I grew up in is the same zip code that I live now and that I'm raising my kids right now, my 3 daughters. And so when I'm looking at this study, what I'm looking at is what's going to happen to change the outcomes for my kids. Because what I cannot accept is the healthcare delivery system that we have today. Because it is broken and it's not working for communities like ours. It's creating a social injustice where people who are from the wrong side of the tracks, we don't get to live as long as those who come from the right side. And there's something that's happening. We have a tremendous amount of poverty, and I think there's something to the opposite of poverty. I call it health. Because when you don't have funds, you can't afford the care that you're not getting the health care that you deserve. Now, I believe that health care is a human right. And I'm proud to say that I practiced my entire life in an emergency room. Where you came to me, I didn't ask what was in your wallet or where your passport said you were from. I took care of you because you asked for my help. Because you came here today to say that I don't have anywhere else to turn. But here's the sad reality that's happening in our community. I worked in Selma, which is the raisin capital of the world, where I took care of farm workers because that's where I grew up. And I was going to dedicate my life to come back to help people. But in the last decade that I was working, I was asked to see 3 times the amount of patients. Because while we're increasing the number of people who are insured, we're not increasing the access to care, and we're not changing the outcomes in our communities. And so I want to answer the mayor's question when he answered it earlier. What are you willing to do? I'm willing to leave my job. I'm willing to go and run for office. I'm willing to come here and to fight. And I'm proud to say that right now I am the chair of the Budget Subcommittee on Health and Human Services. Every dollar that the state spends in health care and welfare comes through my committee. I now have an opportunity to have oversight and to say that communities like mine, communities from the Central Valley, are getting left behind, and then we need to stand up and demand better, that we should expect more. Now, sometimes in this political climate, I can't breathe, you know, and it's just not the poor air quality we have. It's the fact that I feel like the oxygen gets sucked from the room because all we can talk about is things that take 140 characters to say. You know, and I want to actually talk about real substantive policy. I spent my life as a doctor taking care of people, and what I'm seeing are a bunch of politicians who haven't spent a day of their life practicing medicine. I saw 50,000 patients, and I hear their stories every time I'm up here, and I'm hearing the bureaucrats not wanting to actually fix the problems. So I need you to know that you have a champion for a cause up here, not some chump in a chair. You know, I want to stand up for our community because I think we should demand more. You know, in Fresno, I graduated from Edison, which is, you know, some of the highest areas of concentrated poverty in our country. They call us the Appalachia of the West, and what I have seen is a generation of poverty. Now, I haven't seen any changes. I haven't seen any fixes. Now, I'm up here to make sure that we're fighting for health care as a human right. I believe that every human in California deserves to have access to care, and that we need to make our systems more efficient to be able to provide better and more comprehensive health care. That's what I work for and what I dedicate my life for. But I'll tell you, it's not without personal sacrifice. And, you know, it's not always that easy to leave the comforts of what you've prepared your whole life to do. But I wouldn't be here today if it wasn't for someone who believed in me and dreamed that we could do what we're doing. And so with your help, I just want to ask for one favor, please. My wife is in the back of the room. And I would not have been allowed to have run for office if she would not have believed that we could do something. But she married a doctor, not an aspiring assemblyman. But she saw the same fire in me that I think many of you see right now. And she knew that she couldn't stand in that way, that she had to help me, because we both know that our community is struggling and that we need people to stand up and to fight for us. So thank you guys for taking your time to come here to Sacramento. It's been an honor to address you all.
Thanks. That's Faith in the Valley out in the crowd. So as Kane said, Faith in the Valley is a new organization, but we really have a long history within the Valley because we came from a consolidation of 5 county-level organizations that have a long history of organizing in the Valley, 15 to 20 years. And we decided to build a regional structure so that we would be able to move all of the San Joaquin Valley with a shared identity and coordinated campaigns. We had our launching founding action in September, where we had 1,500 people from all over the San Joaquin Valley in that room. We had some of our public officials, including Mayor Tubbs,
and also some of our partners, 20 in total actually. And there we launched a policy platform, which we called the People's Covenant, which looks very familiar. It mirrors the issues of the policy platform that was actually passed out today. It names creating jobs in the clean energy economy, so not jobs that are dirtying our water and air and killing our people. It talks about criminal justice reform and creating a safety net so that everybody can have access to health care, and also the protection of our immigrant communities. We also launched our voter engagement campaign for 2016, and we ended up having live conversations with 55,000 people in 5 of our counties in the San Joaquin Valley. That is 12% of the electorate. And with our partners with the Million Voter Project, these voters that we contacted turned out had a 78% turnout rate compared to 73% statewide. Now you might be wondering, why am I naming off all these numbers, right? And that's because we believe that in order to improve health outcomes for our Valley's children, we have to change the power dynamics of the Valley. And so as the report says, actually, it says low-income communities and communities of color not only face disproportionate risk, but also have less access to decision-making power in policy, planning, and investment. So people with agency and power are healthier. So what do we do? In order to change the health outcomes in the Valley, let's give our people more power. And so for us, what that looks like is this year, as an organization and along with some of our partners, we have 4 main priorities. The first one is let's play some offense. With a strategic policy agenda. Let's also build a resistance. So we know we need to be on the defensive. 3 is build independent political power, and 4 is build regional organizational infrastructure. So I'm going to talk a little bit about each one. So the first one, in moving forward a strategic policy agenda, for us, that's the People's Covenant. So making sure that it reflects the intersectionality of people's lives. We are not, a human being is not a one issue individual. And when we talk about building a resistance, being on the defense is really holding our public officials, our Republicans and our moderate Dems accountable through letter writing campaigns, through patch-through calls, by holding rallies and vigils outside of their offices. It's by supporting sanctuary, not only at the city level, but also thinking about it at the county level and at the state level. So thinking about all of these levels within our government that we're able to influence. And third, build independent political power is creating C4 organizations. So going beyond the capacity that we have to hold people accountable within our C3 nonprofits. It also looks like building voter capacity of strategic partners around integrated voter engagement. So those organizations that are wanting to do voter outreach, those organizations that have the skills to share some of that knowledge. And the fourth is building a regional organizational infrastructure that goes beyond communications and data systems. I was just talking with somebody in the crowd, that it also includes, financial management to make our organizations more effective, and rigorous training programs regionally. So to stop the cycle of extraction in the Valley, where industries are extracting our resources and literally our people's lives, we need to build power. And as a faith-based organization, we believe that people should live as long as God intended, not to be cut short because of corporate greed. And so because of that, we're planning on building power with all of you this year. So let's get to it.
As everybody else have mentioned, I too am not surprised from the report, but I do want to say that this report shows that San Joaquin Valley is one of the fastest growing regions in the state, but faces many challenges as it pertains to social determinants of health, education, of our communities and of communities of color. And it comes at a very timely manner, as this is the opportunity to really strengthen the foundation of where we must continue to invest our efforts to impact change for our communities in the San Joaquin Valley. The San Joaquin Valley is made up of diverse and vibrant communities. The issues we, as Asian Americans and Pacific Islanders, face are not different from those of our brothers and sisters from other communities of colors. We have always lived amongst each other. We go to the same school, we live in the same neighborhoods, and we work together, and so that means we face similar hardships. The Asian American and Pacific Islanders is one of the smaller communities of colors, but the fastest growing population in the Central Valley, in the state of California, and in the United States. The Asian American and Pacific Islander community is an immensely diverse population within itself, with various ethnicities, languages, and experiences. Oftentimes, due to our community being smaller and lack of data disaggregation, our community needs and issues become invisible. So earlier it was mentioned that oftentimes the Central Valley is forgotten. So think about Asian Americans being twice forgotten, right? Because we are smaller. But I thank the San Joaquin Valley Health Fund and all of your partners for recognizing the opportunity to highlight Asian American, Pacific Islanders, and Southeast Asian communities today. I want to start off by highlighting some data from the Southeast Asian American community and the Central Valley that was pulled from the U.S. Census data. The median family income in the Central Valley for Southeast Asians are always lower than compared to both the state and the county averages, where California median income is about $27,000. For Hmong, it's $12,000. For Cambodian, it's $12,000. For Hmong, it's $11,700. And for Laotian, it's $12,900. $11,700 for Hmong in Fresno is also the lowest median income for all Southeast Asian communities of all of San Joaquin Valley region. In addition, Southeast Asian American men in the Central Valley have the lowest bachelor's degree attainment, which are also lower than the state and county averages. The percentage for Fresno men and with a BA degree is 6%, in comparison to only 5% for Cambodians, 5% for Hmong, and only 2% for Laotian. The lowest rate for Cambodian men in Stanislaus County is at 0.008%, equivalent to only 18 individuals. While U.S. Census tends to undercount the Southeast Asian American communities, the data shows alarming trends of both economic and educational, as well as it alludes to health disparities that deserves attention. The CRAC, a national civil rights organization with a branch in California, prioritizes health, education, and immigration issue areas to continue our advocacy efforts. CRAC, or Southeast Asia Resource Action Center, will continue to push for data disaggregation of Asian American and Pacific Islander communities, as it is part of our community's self-determination to analyze our own challenges and develop our own solutions. Unveiling disparities within our communities will give us the tools we need to fight for civil rights promised for under the law. We need critical information about patterns of inequity, poor health, and unequal access across diverse Asian American Pacific Islander communities to equip us in the fight for equal opportunity and quality of life for all. CRAC facilitates a statewide Asian American Pacific Islander Young Men's Coalition, where we convene 13 community-based organizations throughout the state of California to address racial, gender, education, health, and mental health outcomes, and to dismantle the school to prison to deportation pipeline. In addition, we must work together to ensure that all of our community members continue to have health coverage, as what everyone mentioned earlier, that we will be in defense mode, right? where we will be putting our ears to the ground and listening to our community concerns, as well as preserving Cover California and Medi-Cal. It is a beautiful sight today to see our youth, our families, our community-based organizations, advocacy organizations, foundations, local and state elected officials together in one room. This is our opportunity to continue working together to improve the statistics mentioned today and in the report, and to really elevate our advocacy efforts. It is our duty to work together to break the cycle of poverty in the San Joaquin Valley. We must also protect and invest in our young people, our young men, our women, immigrant and refugee populations, as they all highly contribute to the success of our health and our economy. We need better funding and accountability in our schools. We need the local universities to work in collaboration with K-12 school districts to meaningfully engage culturally and linguistically appropriate recruitment and retention strategies with our students and parents in order to increase graduation rates, increase college readiness, the number of college-eligible students, and increase the number of college graduates. In connection to the investment in education in schools, we must work outside of the box to build a thriving workforce. There are many individuals who grow up in the Central Valley, leave for college, return home with no jobs available to them, and then we lose them to the Bay Area or to LA. We must build a school to college to career pipeline in the Central Valley, where these young working professionals are able to return home, participate and contribute in transforming their communities in the San Joaquin Valley. With California's changing demographics, the San Joaquin Valley plays a crucial role in addressing the social determinants of health of our children and families and determining the health of the state. Together with everyone here today, CRAC will continue to exercise our responsibility, our voice, and our power to impact change and ensure that youth, women, communities of color, LGBTQ communities, indigenous communities, immigrants and refugee populations are protected and continue to thrive for generations to come. Thank you so much.
Well, good afternoon, and thank you so much again to Sierra Health and the San Joaquin Valley Health Fund for having Children Now be part of this incredible day at Equity here on the Mall. As they stated earlier, I am born and raised in Fresno, California. I moved up here to the Bay Area about 1.5 years ago. And quite honestly, it was one of the hardest things that I've done. I left for school, so I'd never come back. And when I got bit by the social justice bug, I felt like the greatest difference I could make was in the Valley. And so, while all of my friends up here in the Bay Area kept asking, "Why do you still live in Fresno?" I said, because I feel so convicted about the poverty there and the kids that we know need to break that cycle. And I was very mindfully aware, painfully aware of the fact that given that I am somebody who is white and am mindful of that and the way that plays out in the Valley, that I felt like I even had a stronger, or I should say more of an obligation to come and use that white privilege for purpose and make sure that I was raising up amongst some of my colleagues and friends and people, quite honestly, that I've grown up with that still don't understand that, and I think it takes more of our voices as well, really calling out those disparities. So unfortunately, that's part of why I had to leave the Valley, as I had reached a place. I was the first 5 director in Fresno County. I feel very blessed that I became a mother in my time there in those 14 years, and while I was middle class and had a college education, I didn't know the first thing about raising my babies. And so I had those babies. They are now almost 16 and 11, and my son, who's going to be 16, I met several of, even some of the people in this room when I was pregnant with him. And so I have had the opportunity to live the work, and I know the struggles I have faced raising my kids. My son has some mental health issues, and last week, I am in Thurman's district, who is here, and when we talk about the disparities in health, my son had a mental health crisis last week, and all I could say was, thank God we lived here and not in Fresno. And that broke my heart, because my family, my nieces, my nephews are there, and my son is getting help right now because we didn't live in the San Joaquin Valley. And while I sat there, my family said, well, you should be pleased, he's getting help. I said, it's not fair, because he's only getting help because we live here. And I know that I have, folks that I grew up with whose kids are not getting help, and they are in the same situation as me. And so as a mom today, I'm able to stand here with some remote peace of mind knowing my kid might be okay because of where I live, and that's not acceptable. And so part of what we can continue to need to fight against, as you all know and you're doing in the Valley, is to really push against the political machine, because that's what it comes down to. I realized at First Five, when we were about 10 years in, and over $160 million of our funds just in Fresno County had been invested in young children. And at that point, our poverty rate had gone from 1 in 4 to 1 in 3 kids. So I realized, as the executive director that time, what is going on? And to your point, it was human decisions, it was systems, we could not serve our kids' way out of poverty. I could look at that mom in the broken down trailer in Raisin City that had no running water, she had no transportation, there was no services that are going to change the trajectory for her. What we need to change is how in the world a teen mom ended up living by herself in a trailer in the middle of Raisin City in a field. Those are those systemic things, the story you told this morning, right? What were the policy decisions, the people decisions that were made that created the conditions that really were there for that? And change is hard, especially in a valley that quite honestly has really, when you look at the agricultural and the whole economic basis, it has depended on poverty labor. And we have to call that out. And the fact is that you have a lot of people in positions of power in the valley that while they want to do right by kids and right by families, it's really, really hard. And I know even for me, when I started speaking up and people said, Kendra, you got to be careful. You're gonna get yourself in trouble. And I did. And that was okay, because I stood for what was right. And while it meant that I had to step down from my position because I could no longer be effective given the politics, thank God I landed at Children Now, because we have a board that is committed to eradicating poverty in the Central Valley. They have fully given me and our team the authority to kind of go and push on whatever issues and uncover whatever rocks we need to really expose the realities of the structural racism and institutional racism that exists in many systems in the Central Valley that keep our kids and families in poverty. So again, I as well was not surprised, sadly, by anything in the report, especially we know that disparities and inequities begin before birth. And until we really recognize that this is about investing in our human capital. This is not about, to your point, this is not about handouts. There's no one in this room that I can see on the face who is not incredibly hardworking and wants just the same for their kids and families as any of us do. And so at Children Now, we stand very committed. I am in the Central Valley. I'm in Fresno at least twice a month. We are here to, especially around the local control funding formula. That was the promise of equity in California. And early childhood is an allowable expense. And so we would love to work with any of you in your communities and in your districts to really push this conversation. We know that for the very populations that this report is talking about, that early investment beginning before birth is the way that we get these kids out of poverty. So I am just really proud to be part of this. I am so proud of the San Joaquin Valley Health Fund for its courage and for its boldness and willingness to continue to push these issues and shine light on them in the Valley. And I remain, I am still, my home base and my home address is still in the Valley, so that I can, as well, since I'm home so much, so that my vote there still counts. So I remain committed, and I'm just really proud to be your colleague, and some of you are my longtime friends. So thank you very much for having us be part of this.
Final thoughts you want to offer after hearing each other?
I just really want to reemphasize this idea about stepping into the political space. It's super scary, and probably like you and Dr. Randall shared, I never even thought I'd be in policy, and it's not something that I naturally was inclined to, but I felt like we have to. And so to that point, there's school board races, there's so many different things that those of you in this room, if you can sum up, there's those of us that are willing to come alongside you. So I think to that point of just, none of us think it's going to be us, but I think that there's so many incredible leaders in this work, and that, if we could just encourage you to really consider that perhaps it would be your voice that would be the strong one that could lead, that we could all get behind. So I can't say it enough that I think until we change the voting demographic in the face of politics in the Valley, that this is going to be a much harder ride. So.
Yes, just two final thoughts as we think about different ways of creating that power, that political power. I think sometimes we think of ballot initiatives only at the state level, but really thinking about how do we bring this tool into the San Joaquin Valley. Something as so many of our elections are decided during the primaries, when not many of our people go out and vote. So what about mandatory runoffs? Really changing that political climate within the San Joaquin Valley. And the second one is also, what about the economic power of some of the companies that are in the valley? So not only going to our elected officials, but also those behind them. I'm just thinking about Chevron, who gave $500,000 just for the Trump inauguration. So thinking about, who are the companies that are aligned with our values and who is not. And we also not only have power with our vote, but with our money.
Just really briefly, and irregardless of personal views, I think cannabis legalization is a huge opportunity, especially for the Valley. When we think of not dispensaries and people buying weed, but you think of the manufacturing, the testing, the transportation, the harvesting, the growing, that's an opportunity for folks from the valleys, especially excluding marginalized folks, to kind of get a larger share of the economic pie. So I would, over the next year, your cities, your counties will be coming up with the rules of engagement for that. So make sure you know what's happening, because there's a bunch of rich people, Wall Street investors, billionaires who know the game. So they're at the table, they're waiting, they're watching, they're putting in an application. So I think it's a real opportunity, but if we're not educated and not there, then the opportunity will pass us by as well. So that's has potential to be a huge economic driver, especially for the Valley, and the rules are really being developed now at the state level and at the local level. So it's still time enough to make sure there's something there for folks who have been excluded for a long time.
One thing I want to end with is that we all know that movement is powerful because it's built on people power, right? And so I was at my grandfather's funeral this past weekend, and it was amazing to hear so many different conversations on concerns around Trump's policies and all of that. And, it was inspiring to me because I feel like just your ordinary people are talking about politics now. And so, it's our responsibility, everyone in here, to really turn these concerns into actions, right? And that the next time San Joaquin Valley Health Fund holds another equity on the mall, that it should be 5,000 people here. And not enough room for us to be in the Capitol, but that we're also on the lawn as well. So, this is a challenge to myself, but also to everyone here today.
Thank you.
I'm just going to say this, just as someone who spends a lot of time talking to founders and foundations, that we're so blessed and so lucky to have the Sierra Hills Foundation doing what they're doing, because they don't have to do it. Other foundations aren't doing it at this level. They're bringing them to the table, but I think the leadership of the folks we've heard from today, it's really, lets us know we're not alone. I think they should be honored for their work, because they're actually doing things they don't have to do. They're based in Sacramento, but they've taken this as their special project, and they've kind of helped amplify our voices and our experiences. So I just want to say, on behalf of Stockton and San Joaquin Valley, we really do thank you and look forward to working with you all in the future. Seriously.
Thank you, Mr. Mayor. Thank you. Next, I would like to ask Supervisor Lee Lohr and Stockton Unified School Board Trustee Lang Luntao to join me up here, please. So these two newly electeds who are making their way up to the desk, to the podium. Oh, they're just meeting for the first time too. So I am just thrilled to be introducing the reflections that will be provided by our two elected officials, local elected officials this afternoon. I have to say that these are two elected officials deeply grounded in community values, which is why they are here, why they've chosen to be with us all day. Lang very early this morning on the bus, so I'm so thankful for that. Each and every one, after conversations with them, have resonated, have affirmed for me that they believe the local government has an enormous role in creating strong schools, safe neighborhoods, and economically vibrant communities. They represent the emerging leadership in the San Joaquin Valley that is looking at the most complicated issues in the valley and adding their own personal experience and voice to work on to the solution. So with that as introduction, I'm going to ask Supervisor Lohr to start us off. Supervisor Lohr currently serves as the Merced County Supervisor representing District 2. And following her remarks, we'll go to Trustee Lang Luntao, who currently is the Stockton Unified School Board Trustee, as well as a board member of Little Manila, who performed that outside dance for us this morning. So with that, Supervisor Lohr, I'll turn it over to you, and I think you could just hit your microphone, or you're welcome to come up here.
I'd like to stand because I was sitting over there and I couldn't see Mayor Tubbs. So, good afternoon, everyone. Thank you for being here. I am so honored to join you. For many of us who live in the Valley, unfortunately, the findings are our reality. Our children and our families are suffering. We are hurting. We are in poor health. And we suffer indignities that no one should have to endure. Merced County is part of a region that produces much of our nation's fruits and vegetables, but yet our food insecurity is growing. In Merced County, 45% of children ages 3 to 5 are not enrolled in school, compared to the 38.9% statewide. Locally, a close friend and her family, and I'm sure many of you all as residents, face social exclusion and discrimination at many levels. I was in your seat for many, many years, and I continue to be in your seat, but at a different level. I was frustrated at the findings year after year because this is old news. This is very old news. And that's why I ran for office. I did not know anything about elected office, but I learned as I went, and I dragged people along. Every mayor, every city council member, every school board member, every policymaker, and every resident in the San Joaquin Valley needs to take heed to this report. We must all ask ourselves, what can we do? What will we do to change these statistics? And what actions can we take to create a brighter future for our communities? Local government plays a large role. That's why I ran for office. But you as well play a large role in the fundamental issues that we have been discussing today. And I'd like to underline the importance of local leadership and local culture. We all have work to do. And as a member of the Merced County Board of Supervisors, I understand the responsibility that we have to adopt policy and to act on those policies that many of us have shared today. And while I'm committed to make sure Merced County does its part, it is essential that we all realize these challenges have no boundaries. They are regional issues that need a regional approach. And they require a bigger picture understanding, which many of us must be at the table to resolve. We must be present, we must facilitate, we must teach, but most importantly, we must be teachable. And I ask you today, San Joaquin Valley Health Fund, elected officials, policymakers, and residents such as yourself, let's take the next steps together toward a regional approach, a golden state for all. Thank you.
Thank you, and good afternoon, everyone. So as Kaying so graciously mentioned, my name is Lang Luntao. During the day, I am a teacher. I'm a third-generation teacher, having been born and raised in Stockton. I'm a board member of the Little Manila Foundation, and I'm also proud to serve on the Stockton Unified School District Board of Trustees. So I have the great honor of teaching 10th, 11th, and 12th graders, ethnic studies, sociology, and a new class that I've developed called Community Healing 101. And I'm lucky that many of them are here today with me. We actually got stuck in the basement because we had a little bit of a distraction having a conversation about bicameral legislatures and what that meant. But I will say, if you're down in the basement, young people, remember that you must be taking notes. Your assignment is still due. And I just wanted to take a brief moment to leave you with some of their words. So a couple of months ago, as I was preparing to start my work on the Stockton Unified School District Board of Trustees, I was struggling to figure out where we needed to go first as a community. I think often when we see reports like the one that has been released by the San Joaquin Valley Health Fund, it can be difficult to know where to start. It can be overwhelming considering all of the grand challenges we as a community have. So I decided that I wanted to ask the young people that I work with every day what they wanted to see of their leaders. And I'd like to share some of the thoughts that they had. So I asked my students, what do you think leaders need to know? And what do you think leaders in our community need to do for all of us? And they said, some of us don't feel safe right now. And it is the responsibility of our leaders to protect us all. They said we deserve a proper education. And we know that'll mean increasing resources available for schools, but that's the right thing to do. They said we as students need to be able to learn about our own stories if we want to engage in learning. They said we need to learn about how communities have used art and music to build solidarity in times as unprecedented as the ones we're living in. And lastly, and this is my favorite one, my students said, we need our leaders to help us see not only what America has been, not only what it is today, but to help us understand what America could be, given the work that we do together. So on the first day that I took office as a school board member, I shared these words with my peers, and in large part because of the passion and the life that my students brought, I'm proud that within 3 weeks, our Stockton Unified School District became the largest school district in San Joaquin County to name ourselves a safe haven district. And I'm proud that we, as a district of 40,000 students, affirmed that our schools are safe for all of our students and all of our families. And we affirmed that our schools should be places for grading papers, not for checking them. And I share that with you because I believe we have a lot of work to do, especially in schools. We need safe havens throughout the valley. We need ethnic studies in all of our schools. We need restorative justice, A through G for all. We need socio-emotional support for all of our students. We have a lot of work to do, but we will not be able to do this work unless we are consistent about seeking out the voices that are often excluded. As Harvey Milk said, engaging the us's that often get left out of the table. So I'd just like to end by echoing our Mayor Michael Tubbs, our man from Stockton, and asking, so what are we doing to create the conditions so that in 50 years, a child from Merced or Turlock or Modesto or Visalia is able to be the next school board member, president, mayor, governor? And in addition, what are we doing to enable young people to lead us in this movement today? So for the young people, I believe that we're ready to follow, and we will have your back as you're ready to lead us. Thank you.
Thank you so much, Supervisor Lauren. Thank you, Board Trustee Lun Tao. I really appreciate both of your perspective. We look forward to what you're going to bring to your respective localities, and we are here to support you in any way that you need us to, so thank you. So now I have the sort of the challenge and both the honor of thanking you. The challenge because what an incredible day it has been, and now the time has come for us to part ways, at least just for this afternoon. We get a good night's sleep and get back on the issues that we care so deeply about, right? So I want to thank each and every one of you. I know that we had 19 buses carrying nearly 900 people on top of the hundreds of individuals who are our statewide allies who turn up here at the Capitol to make our first annual, I'm looking at Diane, she's like, oh, don't say annual, our first annual Equity on the Mall so successful. We would not be able to be here, to be able to have this conversation if it were not for each and every one of you. We thank our elected officials, those who I know have extremely busy schedule. were able to step out and participate in this conversation with us. We thank the community members who are joining us from all corners of the San Joaquin Valley, here demanding to make the Golden State truly a Golden State for all. We count on your partnership as we continue to build this movement. The rain did not stop us. In fact, it is clearing the way for our work. And I believe that something beautiful will come out of today's rain, perhaps beautiful rainbows. Today we brought the Valley to Sacramento, and tomorrow we continue the local, regional, and statewide work to ensure that all kids have a bright and healthier future, because they are our future. To quote Margaret Mead, who said, "Never doubt that a small group of thoughtful, although 1,000 individuals is not small, I would say, committed to changing the world. Never doubt that a small group of thoughtful, committed individuals can change the world. Indeed, it's the only thing that ever has." We would love to continue this conversation with you. Please continue to be engaged, stay in touch, continue to add to the conversation that we've begun the last few days through social media. If you have Twitter accounts, please contribute. If you have a Facebook account, please add. And if you do Instagram and other social media, please contribute. We want this conversation to continue. As many of our colleagues and leaders have said throughout the day, February 9th, Equity on the Mall is just not one event. We must not let it be just one event. It must continue. I know each and every one of you will use this report. However, it is going to be appropriate for you to leverage the work that you do. And when you do, please let us know. We're always looking forward to feedback. We're always interested in hearing how you're all using this work. So with that, I want to thank you all so much. Wish you safe travels to wherever you may be returning home. And until we see you again, be well and stay healthy. Thank you.